Welcome back, everybody. Today we're going to be diving into the world of art therapy and cancer care.
Hmm. Sounds fascinating.
It is, really. We'll be exploring a book called Art Therapy and Cancer Care. It's edited by Diane and Caryl Sibbett.
Okay.
And basically, we're going to uncover how art can help patients cope with the emotional and physical challenges that come with cancer.
Right.
And even, hopefully, help them find some meaning and peace along the way.
I like it.
So the book jumps right into kind of a heavy topic, death.
Okay.
Ken Evans, in his chapter on death and dying, he explores what constitutes a good death.
Good death.
Yeah, and it really makes you think about like how different cultures view death, around the world.
Yeah.
And how our own like personal experiences sort of color our perceptions of it.
Yeah, that's interesting. What's interesting, too, is that death is like this universal experience, but it's also like deeply personal.
Yeah.
We have this instinct to like control it, but ultimately we can't.
Right.
And Evans suggests that art can actually help us, grapple with those emotions and even help us find meaning as we face our own mortality.
It makes me think about that Dylan Thomas poem, Do Not Go Gentle Into That Good Night.
Oh, yeah?
He's definitely not advocating for like a peaceful acceptance of death.
Right.
It's more like fighting against it with everything you've got.
Yeah, that really highlights the range of responses that we have to death, I think.
Yeah.
And art can be such a powerful way to, channel those feelings.
Right.
Whether it's through like fiery defiance like Thomas or through more peaceful acceptance.
Yeah, absolutely. The book then introduces this concept of liminality.
Liminality.
Caryl Sibbett describes it as this state of being betwixt and between, like a threshold where everything feels uncertain.
I see.
It seems really relevant to the cancer experience.
I can see that, yeah.
Think about it, like receiving a cancer diagnosis kind of throws you into this liminal space, right?
Yeah.
There's this sudden loss of control and a confrontation with your own mortality and a search for meaning in the midst of all this chaos.
It can feel like the ground has shifted beneath you, for sure.
Sibbett quotes Halverson, Boyd, and Hunter.
Okay.
They say, "We live in limbo. After cancer, we know that we are on uncertain ground."
It really captures that feeling of being, in between.
Yeah.
Not knowing what the future holds.
Mm-hmm.
And what's crucial here, I think, is that art therapy can actually provide another kind of liminal space, a therapeutic one.
Okay.
They can give patients a language,
Yeah.
a way to express those feelings, those anxieties, through art,
Right.
ultimately helping them to, regain some sense of agency.
It's interesting because so much of the cancer experience is about feeling powerless.
Yeah.
Your body is changing in ways you can't control. You're relying on medical professionals, and the future is so uncertain.
It's true. It's like art therapy can flip that script.
Yeah.
Instead of being passive recipients of care, patients become active creators,
Okay.
expressing themselves,
Right.
processing their experience through art.
So it's about like reclaiming power through creativity.
Absolutely. It shifts the focus from like what's happening to me
Yeah.
to what can I create in the midst of this.
I like that.
And, there's even like a playful element to it.
Play, when we're talking about something as serious as cancer,
I know. It might seem like surprising.
it does.
But think about what play actually is.
Okay.
It's exploration, experimentation, losing yourself in the moment. And those are all things that can be so healing, especially when you're facing something as difficult as cancer.
So art therapy is creating a space where patients can like tap into those feelings of playfulness again.
Exactly. Sibbett actually ties this into the concepts of flow and kairos.
Oh, okay.
So flow is that feeling of being totally absorbed in something where time just kind of disappears.
Yeah.
And kairos is that perfect moment, that opportunity, a chance for like transformation.
She describes how like patients often lose track of time when they're making art.
Yeah.
And they experience this kind of sense of upliftment afterwards.
Like they're tapping into something really powerful.
Yeah.
It goes back to that idea of art therapy providing that therapeutic liminal space.
Right.
Patients are processing these experiences and finding, their inner strength through art.
It's almost like the artwork itself becomes this container for all those complex emotions.
That's a key concept.
Yeah.
Sibbett talks about how artwork functions as a container for these difficult feelings, drawing on Diane's ideas.
Okay.
It can be a talisman, a source of comfort,
Right.
even like a scapegoat for all that pain and fear they're carrying.
Yeah, I remember reading about a patient who, created this creature in her art.
Okay, yeah.
And she said it felt like a companion to her when she was frightened. It's remarkable how artwork can become this source of, tangible support.
It is. And sometimes part of the therapy can even involve, destroying the artwork.
Oh,
It's symbolic of releasing those emotions, letting go of what no longer serves them.
So the art becomes kind of a vessel holding those feelings, and by destroying it, they're released.
Exactly. It's a really powerful visual and symbolic act.
Yeah.
And the artwork can become a site of transference, too,
Okay.
where patients, project their feelings and relationships onto the art and the therapist.
It's incredible how art therapy addresses so many layers of the cancer experience.
It is.
Not just the emotional, but the physical, too.
Mm.
Sibbett really explores this in her chapter, Liminal Embodiment, Embodied and Sensory Experience in Cancer Care and Art Therapy.
Right.
She reminds us that cancer isn't just a disease. It's
Yeah.
like a deeply embodied experience, that affects our sense of self.
Think about the physical changes, the pain, the fatigue, the treatments.
Yeah.
All of that impacts how people feel in their own bodies.
Yeah.
And this is especially true for those with, visible signs of the illness or treatment side effects.
It's like their sense of self becomes kind of fragmented,
Yeah.
making that concept of liminality even more relevant.
Totally. They're caught between their old self and this new, unfamiliar body.
Yeah.
And that's where art therapy can be so powerful. It can help them to, confront and reintegrate their bodies through art. It's a space to process those feelings, the shame, the fear, the isolation
Yeah.
that often come with these physical changes.
So it's not just about expressing emotions.
Right.
It's about reclaiming ownership of your body,
Absolutely.
accepting those changes, and kind of finding self-acceptance.
Exactly. And Sibbett emphasizes that this process isn't just about the individual. It's also about recognizing and addressing, the social stigma that surrounds cancer.
Because there's often this kind of unspoken fear or judgment around illness, which can make people feel even more isolated.
It can be incredibly isolating. This is where the idea of communitas comes in.
Okay.
That sense of shared experience and connection.
Right.
Art therapy groups especially can foster that sense of belonging and support,
Yeah.
where patients realize, I'm not alone in this.
The book mentions a group within the British Association of Art Therapists.
Okay.
They're called the Creative Response, and they focus on art therapy in palliative care.
That's interesting. It really shows how valuable this field is becoming.
Yeah, I think so. It shows this growing awareness of art therapy's role in supporting patients, not just during treatment,
Right.
but as they approach the end of life.
Yeah.
And it's not just adults who can benefit from this.
Right.
The book also explores the challenges and rewards of working with children with cancer.
Of course.
Cinzia Favara-Scacco's chapter, Art Therapy as Perseus's Shield for Children with Cancer, really gets into that.
Kids face such different challenges, don't they?
They do.
They might not even have the words to express what they're going through.
Yeah.
And they're dealing with these, scary medical procedures
Right.
on top of, a loss of normalcy in their lives.
Favara-Scacco explains how art therapy can help these kids cope with the pain and fear, express those complex emotions,
Yeah.
and even, maintain a sense of playfulness.
Right. Despite their illness.
There's this really powerful example in the book about a 2-year-old girl.
Okay.
Her name is Felicia, and during a bone marrow aspiration, which is, incredibly painful,
Oh, yeah.
the art therapist used fantasy-based storytelling to help her cope.
Oh, wow.
It's amazing how art can create this, world of distraction
Yeah.
and comfort in such an intense situation.
It really is. There's another example about a girl named Rita.
Okay.
She was really struggling with, feelings of anger
Mm-hmm.
and a lack of control over her treatment.
Yeah.
And structured drawing became this way for her to kind of channel those emotions in a healthy way.
It shows how art can be this outlet for, bottled up feelings.
Exactly.
Yeah.
And it's not just about giving children a voice.
Right.
It's about recognizing the impact cancer has on their families, too.
Yeah.
Favara-Scacco emphasizes how important it is to involve parents in the art therapy process.
Okay.
So they feel empowered and supported, too.
That makes sense, because if the parents are feeling overwhelmed and helpless,
Right.
it's going to be even harder for the child to cope.
Exactly. And it creates that shared experience.
Yeah.
That sense of communitas within the family.
Right.
Which can be so strengthening during a difficult time.
The book also talks about the role of the art therapist.
Mm-hmm.
And it's not just about, like, providing materials and techniques.
Right.
Malcolm Lermonthe talks about the importance of the therapist's silent, attentive presence, which creates a safe space for patients to express themselves, without judgment.
It's about holding that space.
Yeah.
Being a witness to the patient's experience without, trying to interpret or analyze it. Allowing the art to speak for itself.
Yeah.
And for the patient to find their own meaning.
There's a case study about a patient named Eve.
Okay.
And she was unconsciously using her art to explore these feelings about illness and death.
Wow.
And the art therapist's role was just to, be present.
Yeah.
To listen and create that container for her process.
It speaks to the power of just being seen and heard.
Yeah.
Especially when you're going through something so isolating.
Absolutely. And it's about recognizing that the art therapy process is a journey. It can take many forms.
Right.
Diane describes this group art therapy program called The Healing Journey, and it's designed for patients with long-term illnesses.
It sounds like a beautiful program.
It does. Waller explains how it helps patients integrate the physical, emotional, psychological, and spiritual aspects of their experience.
Wow.
She uses guided imagery, art making, and discussion.
It's not about, finding a cure or denying the challenges.
Right.
It's about acknowledging the full spectrum of the illness experience.
Yeah.
And finding ways to live more fully within those circumstances.
There's an example about a woman named Jill.
Right.
She used art to process her feelings about breast cancer, her body image, and her relationships. It's like the art became this mirror, reflecting those complex inner landscapes.
Yeah.
And helping her find a new sense of wholeness.
It's about finding ways to move forward.
Right.
Even when the path is uncertain. Healing isn't linear.
Yeah.
It's a journey with, twists and turns.
And art can be a powerful companion on that journey.
Absolutely. And sometimes that journey involves confronting our own mortality.
Yeah.
Paula Luzzatto, in her chapter, Musing with Death in Group Art Therapy with Cancer Patients, she explores how art therapy can help people face those fears and anxieties about death.
This is getting heavy. We're talking about the ultimate unknown here.
I know, right?
And how art can help us approach it.
Yeah, Luzzatto explains how art can provide that safe space to explore those difficult emotions, process that fear and grief, and even find a sense of closure.
She shares this remarkable example of a patient who painted her dream of being dead.
Wow.
And the act of creating that image, of externalizing that fear, actually helped her find peace.
It's almost like by confronting our fears through art, we take away some of their power.
Yeah, I think so.
It's about recognizing that death is a natural part of life.
Right.
And by accepting that, we can live more fully in the present moment.
This has been a fascinating look into the world of art therapy and cancer care so far.
It has.
But it's clear this work isn't without its challenges.
Right.
The book also talks about the experiences of art therapists, working in this field and the emotional toll it can take.
Timothy Dewsbury, in his chapter, Art Therapy in the Hospice, Rewards and Frustrations, he reflects on the intensity of the work, the importance of self-care, and having good support systems.
He even talks about his own experience with cancer.
Oh, wow.
And how it deepened his understanding of the patient's journey.
That's a really powerful perspective. It highlights the vulnerability and empathy that are so essential in this field.
It really does.
It speaks to, the interconnectedness of it all, It's not just about the patient or the therapist.
Right.
It's about that shared human experience.
Yeah.
Of facing illness, loss, and just the fragility of life.
Dewsbury also discusses the frustrations, of working within a system that often undervalues art therapy and the challenges of getting funding and support for these programs.
That's a huge point.
It is. It makes you think about how we prioritize funding and resources in healthcare.
Right.
How much we focus on just the physical aspects,
Yeah.
sometimes overlooking the emotional and spiritual needs of patients.
Exactly. Art therapy reminds us that healing isn't just about treating the body.
Right.
It's about addressing the whole person,
Yeah.
recognizing the power of creativity and expression as part of that process.
Dewsbury actually describes his work as holding a safe space for patients to explore those difficult emotions.
It's a beautiful way to put it.
It is. He also talks about how art therapy can help patients, find their own inner resources and tap into their creativity as a way to cope.
It's about empowering them to be active participants in their own healing,
Right.
even when facing difficult situations.
It's a good reminder that even amidst illness, there can still be moments of beauty and connection
Absolutely.
and creative expression.
It raises an important question, though.
Oh, okay.
How can we better support art therapy programs
Yeah.
so more patients and families can access these resources?
That's something for all of us to think about
It is.
as we reflect on what we've learned today.
Absolutely. And it brings us to our final thought-provoking question for you, the listener. What role does creativity play in your own life, particularly during times of challenge or change?
It makes you think about how we can all, tap into our creative potential.
Yeah.
As a way to cope, to heal, to find meaning amidst life's ups and downs.
It's a good question to ponder.
Good.
And maybe it'll even inspire you to, pick up a paintbrush.
Yeah.
Or a piece of clay or any other creative outlet.
That speaks to your soul.
Exactly.
Thank you for joining us on this deep dive into art therapy and cancer care.
Thanks for listening.
So we've been discussing how art therapy can offer this, safe space for exploring these complex emotions. But it seems particularly relevant, when it comes to facing our own mortality.
Yeah, I agree.
Paula Lozado, in her chapter, Musing with Death in Group Art Therapy with Cancer Patients, she really delves into this.
It's true. Death is like this ultimate unknown.
Yeah.
And Lozado explains how art can be kind of a bridge to that unknown.
Okay.
Providing a way to, process those fears and anxieties.
She calls it musing with death, which is such a, beautiful way to frame it.
It is. It's not about, dwelling in the darkness,
Yeah.
but finding a way to engage with those feelings.
Right.
And maybe even find some, beauty or meaning in that process.
It's like the art becomes a way to sort of communicate those fears and anxieties in this safe and contained way.
Yeah, it's like bridging the gap between our inner and outer worlds.
Right. Exactly.
And remember, this process, it affects the therapist too.
Oh, yeah.
Dewsbury talks about how working with dying patients can be so challenging emotionally.
Yeah, I bet.
And how important it is for art therapists to have their own support systems.
Right.
And self-care practices.
It makes sense because they're carrying so much emotional weight.
Yeah.
Both their own and that of their patients.
He even shares how his own experience with cancer, deepened his empathy and understanding of what his patients were going through.
It makes you realize how much of this work is about connection.
It is.
About recognizing our shared humanity and supporting each other through these tough times.
Yeah.
It's not just about the art.
Right.
It's about those relationships, the empathy, the shared journey.
Absolutely. It really highlights how important it is to recognize and value the work of art therapists.
Yeah.
They're often on the front lines of these challenging situations.
They're not just providing a service.
Yeah.
They're creating this space for healing and connection
Yeah.
and meaning making.
Ooh.
It's so much deeper than just providing art supplies and techniques.
Exactly. Dewsbury actually describes his role as holding the ground, which I think is such a powerful metaphor. It's about providing that stability and safety.
Right.
And a foundation for patients to explore their own inner landscapes.
He also talks about how this work forced him to kind of confront his own anxieties about death and dying.
Yeah, which makes his perspective even more valuable, I think.
Right.
It's a good reminder that we're all in this together.
Yeah.
And that by facing these, difficult realities, we can actually find a deeper appreciation for life.
Right.
And for human connection.
He even shares this anecdote about working with a patient who had this rare form of cancer. And he was amazed to later discover a poem by W.H. Auden.
Oh, wow.
That specifically mentioned that type of cancer.
Like those unexpected synchronicities.
Yeah.
They remind us that we're not alone in our experiences.
Right.
It kind of speaks to the interconnectedness of everything.
Yeah.
And how those moments of shared meaning, they can pop up in the most unexpected ways.
It's true. Sometimes you stumble upon something that just perfectly captures what you're going through, and it's so validating.
It makes you think about how art and literature connect us.
Yeah.
They give a voice to these shared experiences and help us make sense of the world.
Dewsbury also picks up on that idea of liminal embodiment
Okay, yeah.
that Sibbett discussed. He describes his own cancer journey as this fluctuating state of heightened own death-life awareness.
What?
It's like, the diagnosis just catapults you into this, like, in-between space.
Yeah.
Where you're constantly aware of both the fragility and the preciousness of life.
He even mentions that as an art therapist, he was already experiencing a form of, like, secondary liminality.
Right.
By witnessing his patients' journeys with cancer.
Yeah.
But then when he received his own diagnosis, it became even more, like, personal.
Right, and profound.
Yeah, he describes feeling like Hermes, the guide of souls in Greek mythology.
Mm-hmm.
It's a powerful image for the role of the art therapist.
It is.
Who often accompanies patients on that final journey.
It's like they're holding space for both life and death.
Yeah.
Helping patients navigate that liminal space.
Exactly.
With compassion and understanding.
And Dewsbury doesn't shy away from the challenges of this work either.
Yeah.
He talks about the emotional toll it takes on therapists.
Right.
The frustration of working within a system that, often undervalues art therapy.
Yeah.
And the constant struggle to secure funding and support for these, vital programs.
It makes you wonder if we need to, like, reassess our priorities as a society and recognize the importance of holistic healthcare.
Yeah, I think so. Healing isn't just about treating physical symptoms. It's about addressing the emotional, psychological, and spiritual needs of patients.
Exactly.
And art therapy plays a vital role in that.
Dewsbury even describes a time when he found himself questioning the value of art therapy.
Oh, really?
Yeah, he was like, why art therapy? It seems like he needed to reaffirm the importance of this work, not just for his patients, but for himself, too.
And did he find that answer?
Yeah, he did. He found it in the stories of his patients, in those moments of connection and creativity they shared, and in the realization that, even amidst suffering, there can be beauty, meaning, and this profound sense of human connection.
It's a powerful reminder that even when we're facing our own mortality, we can still find ways to create, connect, and find meaning.
It's a testament to the, like, transformative power of art therapy.
It is.
Not just for patients, but for the therapists who walk alongside them.
It's about recognizing that even in, like, the darkest times, there's always that spark of creativity.
Yeah.
A potential for connection. And a possibility for healing.
That's beautiful. That leads us to, like, the specific techniques and approaches used in art therapy.
Okay.
What are the tools and methods that bring these ideas to life?
Well, art therapy embraces such a wide range of, like, creative outlets. It's not just painting or drawing.
Right.
Think clay, music, poetry, even movement and dance.
It's like this diverse toolkit.
It is.
Of creative expression.
The therapist helps the patient figure out, like, which tools work best for them.
Okay.
Precisely. And the choice of materials often reflects, like, the themes being explored. Sibbett points out that clay, for example, can be really powerful for working with body image issues.
Oh, okay.
Because of its tactile nature,
Right.
It allows for this, like, direct and physical engagement with form and shape.
It makes sense when you think about it. You're literally molding and shaping this clay, which can be this powerful metaphor for, reclaiming ownership of your body.
Exactly. The book even gives examples of patients using clay to create, like, breasts or torsos.
Wow.
Or even representing their cancer as a lump or a distorted form.
And remember Mrs. Verdier?
Oh, yeah.
The woman with breast cancer.
She found so much solace and even a sense of, like, reclaiming her femininity through working with clay.
Yeah.
Creating and recreating breasts as a way to process her experience.
It's fascinating how art can become this tangible representation of, like, their inner struggles.
It is.
Allowing them to confront and process those feelings in such a, like, concrete way.
And remember, sometimes the process itself is more important than the finished product.
Right. Think back to Sibbett's discussion of flow and how patients would lose themselves in the act of creation, finding that release and peace in the moment.
Totally. She even talks about how, like, simple activities, like structured drawing or even doodling, can be so therapeutic. It's about finding that rhythm, that absorption where the anxieties just kind of melt away.
Right.
And the creative process takes over.
It's about accessing that state of play.
Exactly.
That we talked about earlier, where judgment is suspended and there's freedom to experiment and express without limitations.
Yes, and we can't forget about group dynamics.
Right.
They play a huge role as well.
You're right. Sharing that creative space with others who are facing similar challenges, it can really foster that sense of community and support.
Absolutely.
The book emphasizes how powerful those shared experiences can be.
They are.
Those moments of communitas in the healing process.
Luzzatto, in her work with cancer patients, she emphasizes the importance of group discussions.
Yeah.
Where patients can share their art, their stories, their reflections on the creative process.
Right.
It's about creating this space where vulnerability is welcomed and people feel safe expressing their, deepest fears and anxieties.
And the art therapist kind of becomes this guide in those moments.
They do.
Facilitating that dialogue, making sure everyone feels heard and respected, and helping to create that sense of shared meaning.
But this work, it comes with a lot of responsibility. It's not as simple as just handing out art supplies.
Right, right.
There are these important ethical considerations that art therapists have to navigate.
Absolutely. Like creating that safe and supportive environment is so important. Patients need to feel empowered to explore their emotions, but also boundaries need to be respected.
Yeah.
And the therapist's role needs to be clearly defined.
Do you remember Dewsbury's discussion of transference and countertransference?
Yeah.
It's crucial to recognize those dynamics.
Right.
And make sure that the therapeutic relationship stays professional.
Yeah.
And focused on the patient's needs.
And it's about understanding that art therapy has its limits, right?
Exactly. It's not a replacement for, medical treatment or psychological counseling.
Yeah.
It's a complementary approach,
Right.
that can support patients as they navigate their journey.
And it's important to remember that every patient is unique,
Mm-hmm.
right? And their response to art therapy will be just as individual.
Yeah.
There's no one-size-fits-all approach.
Absolutely.
And the therapist needs to be sensitive to those differences and adjust their techniques accordingly.
For sure.
And it's worth noting that art therapy is still this relatively young field.
It is.
There's a lot of research that's still being done to validate its effectiveness
Yeah.
and advocate for its integration into healthcare more broadly.
That's so important. We've seen through all the examples in the book how powerful art therapy can be.
Right.
But having solid research to back that up is essential.
Absolutely. It's needed for securing funding, training more therapists, and making sure these services are available to everyone.
Exactly.
We also need to move past this misconception that art therapy is just, arts and crafts.
Yeah, it's so much more than that.
This is serious work. It's grounded in psychological theory and clinical practice, and its potential for healing and transformation is, huge.
So as we wrap up this deep dive, take a moment to reflect.
Okay.
What resonated most with you? What stood out as, particularly impactful or insightful?
Maybe the concept of liminality.
Yeah.
And how it reframes the cancer experience.
Or maybe you connected with the idea of art as this container for those complex emotions, a way to, externalize those feelings and find some release.
Maybe you're inspired by the resilience and creativity of the patients and therapists in the book.
Yeah.
And how art can spark healing and connection, even in those darkest times.
As we move forward, consider how you might incorporate more creativity into your own life.
Yeah.
Not just as, a form of entertainment.
Right.
But as this tool for self-discovery, for processing emotions, for finding meaning and connecting with your inner world.
That's a great point. Thank you for joining us on this exploration of art therapy and cancer care.
It's been a pleasure.
We hope it sparked your curiosity, expanded your understanding, and, inspired you to embrace the power of creativity as a force for healing in your own life.
So we've talked about all these different creative outlets, that are used in art therapy.
Yeah.
It seems like there's really something for everyone.
There is.
But how do therapists actually, work with these materials?
Right.
And how do they, facilitate the group dynamics?
Well, when it comes to specific techniques, it really varies, It depends on the patient and their needs.
Right.
Some therapists might use more structured approaches,
Okay.
like guided imagery or mandala drawing.
While others might encourage, more free-flowing expression through painting or sculpting.
It sounds like the art therapist is kind of like a guide, in a way.
Yeah.
Helping the patient find the best way to express themselves through the art.
That's a great way to put it.
Yeah.
They're not there to teach, artistic skills.
Right.
But to help the patient tap into their own creative voice and use art as a way to, process their experiences.
And what about the role of the art therapist in group settings? Like, how do they manage those dynamics
Yeah.
and make sure that everyone feels supported?
It's a balance, for sure.
Yeah.
The therapist needs to create that safe and supportive space
Right.
where everyone feels comfortable sharing, their work and their stories.
Yeah.
But they also have to manage any, potential conflicts
Right.
or power dynamics that might come up.
Do you remember how Luzzatto talked about the importance of, clear boundaries?
Yes, and a strong therapeutic presence.
Yeah. That's got to be especially important in group settings, I imagine.
It is, because the dynamics can be, more complex.
And I bet it's so rewarding for patients to see that they're not alone in their struggles.
Absolutely.
And to connect with others who understand what they're going through.
That sense of shared experience and support can be so powerful.
Yeah.
It goes back to that concept of communitas that we've been talking about.
Right.
In those moments of shared creativity and vulnerability, something really special can happen.
We've also talked about the importance of ongoing research in art therapy.
Yeah.
What are some of the key areas that researchers are kind of focusing on right now? And how is that research shaping the field?
Well, researchers are looking at a lot of different things.
Okay.
From the effectiveness of art therapy for specific conditions, like anxiety and depression, to the impact it has on quality of life and coping skills for those facing serious illnesses.
Right.
They're also looking at, how creativity works in the brain.
Oh, wow.
And how art therapy can actually affect brain function.
It's fascinating how science is starting to catch up.
I know, right?
With what art therapists have known intuitively for years.
It is. And as more research comes out, it helps to, legitimize art therapy.
Yeah.
In the eyes of the medical community.
Right.
And to advocate for its, wider use in healthcare.
It's exciting to think about the potential of art therapy to reach even more people.
It is.
And to help them, navigate life's challenges in this creative and meaningful way.
It really is. Art therapy gives us this, unique lens through which to understand ourselves and to process our emotions and to find healing and connection.
As we wrap up this deep dive, I encourage you to consider how art and creativity can play a more kind of prominent role in your own life.
I agree. That's a great takeaway.
Whether it's, picking up a paintbrush or writing a poem or even just taking a walk in nature and appreciating the beauty around you, there are so many ways to tap into that creative potential.
And remember, you don't have to be an artist to benefit from art therapy.
Right.
It's about the process, not the product. It's about giving yourself permission to explore, to experiment, and to express yourself without judgment.
This has been a really enlightening journey into the world of art therapy and cancer care.
It has.
Thank you so much for joining us.
Yeah, thanks for listening.
And for engaging with these powerful concepts. We hope you've gained a deeper understanding of the transformative power of art and its potential to heal, connect, and inspire.